If you say the word cancer, it brings up all kinds of thoughts, feelings and emotions for all of us probably. No one would want, would they, a cancer diagnosis? It'd be extremely frightening and extremely concerning. And this fear of, or paranoia really, about the word cancer or about cancer as a diagnosis also spread through the acupuncture colleges when I was a student, because we were always told, you know, when you first graduate and when you're in the student clinic, you can't treat people with cancer. This is something that should only be done by very experienced practitioners who really know what they're doing. And the implication was that you might be going to do something wrong or something to make it worse, although that was never explained. And the assumption I made in my own mind was, since I understood cancer to be a growth or an overproduction of cells, the body was producing too many cells of the wrong kind and then not recognizing them, that if you came along and treated with acupuncture, you might be promoting more growth of these unwanted cells. This was my rationale for it. No one gave me an explanation, so that was all I came up with. And a little while after I graduated, I actually went and worked in a hospice where I was treating cancer patients, and I came to realize that all this fear around it is really unfounded, that there's no reason why a practitioner who's recently graduated or who doesn't have years of experience shouldn't be treating cancer patients, because they're human beings after all. And not only that, but they're all going to be under the direction of the oncology department, and if there are any cautions or reasons why you shouldn't treat that patient, then that will have been made very clear. And in fact, I've met patients with cancer where the instructions from the oncology department have been something like, don't stick any needles in the right arm. But apart from that, there are no concerns. So once I realized that acupuncture actually can help people with cancer, I was able to dispense with that fear of it, that worry about it, and start to concentrate on actually helping people. And really, you treat a cancer patient just like any other patient. You go through a full consultation with them and try and find out how you can help them, what their needs are, and as best as possible make a diagnosis in your own terms, in terms of acupuncture. And what's happening increasingly is that oncology departments are referring patients for acupuncture. Often this is for pain, other times it's going to be for trying to help with the side effects of chemotherapy or medication. And of course, a lot of the time, I believe, where it really comes into its own is helping people deal with the fear and trauma of that diagnosis. I mean, who wouldn't be extremely frightened, worried and concerned if they were given a diagnosis of cancer? So in terms of a Chinese medicine diagnosis, like a lot of things when you boil it down, cancer often comes down to a diagnosis of stagnation. Sometimes cold and stagnation, sometimes blood stagnation, but pretty much always stagnation. If we take that back to that idea of the cell production, if energy is stuck, if energy is not moving and flowing as it should be, then you're much more likely, aren't you, to get mutations. So from a very, very simplistic perspective, I could see cancer as stuck energy, which is then growing in the wrong way. And if we're able to just use our basic principles to encourage, as we always do, qi and blood to move through the body in a healthy manner, then that will be a good thing. And all my worries about spreading cancer really are irrelevant, because the body's moving blood and cells and lymph, etc., all around the body all the time. So if the cancer's going to spread, it will have already spread through the blood. So any worries or concerns about us making it worse, I think are unfounded. So there are kind of three areas, aren't there? One area is the emotional side of it, helping people deal with the emotional trauma. Another area is the physical side of it, helping people deal with physical pain which they may be suffering. And the third area is dealing with side effects. I remember a patient who I treated years ago who was having chemotherapy on the face, and she'd always feel absolutely awful after that, and she'd have a 2-week break between treatments, and during that interim period we would just help keep things moving through the face, get the blood moving and the chi moving, and she had some relief. But also what we did, which I think is at least as important and often more important, is to help people calm down, relax and be. Because when you've got a diagnosis like that, one of the things which comes up for people is just a feeling of absolute hopelessness and helplessness, that there's really nothing you can do for yourself other than sit there and feel terrified about what might be going to happen to you. And this is not rare. It's important to realise that a large percentage of us will get cancer, and most of us, unfortunately, at some time in our lives, are going to experience having a frightening diagnosis and just sitting there and thinking, oh my goodness, it's all going to end. What can I do? There's nothing I can do. I feel helpless and I feel terrified. And that's really not a nice place to be. But it certainly is a place where acupuncture, and I'm going to suggest something more than that in a moment, acupuncture can really help, just to help people relax, calm themselves, and relieve the anxiety which would be related to the condition. So we're talking about our really ordinary, basic, very everyday calming treatments here, aren't we? Things that my graduates will certainly know about. Things like the 4 gates, things like possibly the AE drain, possibly using the NADA protocol, the ear points, possibly using the MAR points on the forehead, the points that help to relax the mind. Just things, and points obviously, possibly pericardium points, just general things which help a person to calm down and relax and accept the situation that they're in. Now when it comes to pain, you diagnose that in the usual way. Where is the pain? Which channels and meridians are involved in that? Which organs maybe are involved in that, although it's more likely to be channel work. How can we keep the chi moving to relieve the pain? What protocols are there for that? Again, the 4 gates is still going to come into that, because it's not only a relaxation protocol, it's a pain protocol as well. It's a good protocol to use for pain conditions. The liver is always involved in smoothing the flow of chi around the body and relieving pain. Always, nearly always. So when it comes to recovery, that may be a little bit more complicated, but the principles are the same. Where is the pain? How do you feel? If you're feeling, if a person's got nausea, then we're going to look up points which might be good to help with nausea. There is going to be plenty of information about some basic protocols you can use, including those ones I've already mentioned. I would also say that, cheesy as it may sound, getting a serious illness like this or getting a diagnosis like this is an opportunity. Now, I know it doesn't seem like an opportunity, but it's an opportunity for self-acceptance, an opportunity for accepting life as it is, and I suppose ultimately, depending on the person's age and circumstances, an opportunity to begin to prepare oneself for death, because that's inevitable and it's going to happen to all of us. And the better we've started to work on understanding how we can accept that before we die, the better quality of life we can have. Because if we're having a life where we're scared, stiff and frightened about our death and about our pain, then we're not going to be able to enjoy it as much as if we can live through a process of accepting life as it is and accepting ourselves as we are and accepting what reality we are living in and creating for ourselves. So I have sometimes found, certainly for myself but also for some patients, that some kind of discussion around this is useful, and quite how far you go with that depends upon that patient and how much they can take. So you may just talk to them about relaxation. You may be able to move on and talk to them about acceptance, and you may be even able to go a step further than that and talk about a whole philosophical or religious view of what your life is, what it means, and possibly even a stage beyond that to realizing that you don't have a life at all anyway. There's nothing personal about this experience. You've made all that up. That's all something that we have created for ourselves, and that once we're able to see that, then things get an awful lot easier, or potentially they do. Now that's going to be a step much too far for most people, and I probably haven't explained it in the best way, but there are plenty of people who talk about that and write books about that, about ways of changing your philosophical view of life. Most people won't go for that, but some will. So to sum this up, what I'm saying is, don't be afraid to treat people with a cancer diagnosis. You always have the safeguard that they're already under the guidance of their oncology department anyway, so that gives you a safety shield, if you like. And then you can start to simply treat them as people. How can I help you? What are you experiencing? What are your feelings? What are your symptoms? What would you like me to try and do for you? And just to be with those people and empathize with those people and treat those people as we do with any patient. So don't be afraid of cancer.